We're going to start with the bisecting technique. We're going to do the bisecting technique, and remember there's only two techniques. So there's a bisecting technique, and then there's the what?
Bisecting and...
Going once, going twice. Parallel. Okay, parallel. So, and I'm actually going to use some of those terms. We are doing the bisecting technique, but we're going to be talking about parallel in this technique, you know. It's got nothing to do with the actual technique. It's just something that's going to get you to take a better x-ray. So remember that we are going to be doing bite wings. It's the first thing that we're going to be doing. And then, what is this called? This is the bite wing tab. The bite wing tab. So on there, remember it says to fold on there, and then when we fold it, we have those two little wings that come on out, and then remember that this is going to go to the plain side of the film, and the film in dentistry has different colors depending on the speed and some of those things. So this just happens to be like two. Is it going on the other side?
It's black.
Yeah, it's actually going because it's red right here. Every once in a while, I'll probably have you tap the back side, and then it'll show again.
Should I tap it?
Sure, just so you can do it, and you can see it goes back on again. And then we're going to take this, and remember for bite wings, it's horizontal. It's not vertical. It's not vertical, it's horizontal. And then we're going to take the bite wing tab and we're going to place it as centered as you possibly can to where you have an equal amount on top and an equal amount on the bottom. Okay, and it's right in the center. This is one way to do it. But the other way is that we can actually take that tab, keep it in the center, but we're going to push it all the way to the edge. So we'll talk about that when we get over there to the other side, and then you'll see how that might benefit you when we do it that way. So. Okay, do you recall the reason why we take a bite wing x-ray from last week? There was a lot going on last week, so if you didn't remember, it's okay. But what was the main reason why we take a bite wing x-ray?
To check for...
Check for caries. In what particular area?
The middle.
You're okay, so the middle... The middle between two teeth. So we call that the interproximal space. The interproximal space. So if we're looking at these teeth right here, if we're looking at these three teeth right there, this is the interproximal space. Now these teeth are obviously pretty wide apart, so this wouldn't be too difficult to see between them, all right? But when they're close together, we want to do our very best to separate those using our PID, the camera. So we're going to be referring to this as the PID, position indicating device. Position indicating device. So we want to try to get to see between those interproximal spaces. So we'll talk a little bit more about that in just a bit. So when we're talking about the film and we place it in the patient's mouth, generally you can kind of see from the side that the upper teeth are more forward than the lower teeth if you're kind of looking at that. But if you take a closer look at the premolars, you'll see that the premolar on the bottom, the first premolar, is more forward than the upper one, okay? Can you sort of see that? So if you can't see that, here's the first premolar on the bottom, first premolar on the bottom, and then if you look at the upper one, it's a little bit more back. It's a little bit more back. Do I have it on the right one? No, I don't have it on right there. But it's still a little bit further back, you know. So when we take a picture, we want to make sure that we include the uppers and the lowers. So for the most part, for a patient's normal bite, we're going to make sure that we reference the lower ones. And then we're going to go ahead and take the film, and then, and I kind of mentioned this last week, but if we are doing a premolar picture, if our focus is a premolar picture, what tooth do we want to try to include?
Canine.
The canine, yeah, at least half of it. So, and by the book, it just says the distal half, the distal half of it. But when you place this in the patient's mouth, I want you to try to include the entire canine, So that edge, this edge right here, is going to completely cover that canine. It depends on where you're standing. You want to make sure that you are standing on the side of that patient that you are working on. If you're standing in the front of that patient and you try to reference the side, you probably will miss it, okay? So we're going to take it, I'm going to place it in the patient's mouth, I'm going to identify the canine. The canine is right here, and I'm going to make sure that the edge of this completely covers that canine, And stop me at any point if I'm losing you, okay? Are we okay so far? Okay. I want to maintain that. So I'm going to go through that whole motion of putting my finger on that tab on the occlusal surface, asking this patient to bite down how? Slowly, yeah, slowly. And then when the patient starts to close down, I'm going to rotate my finger to the buccal side, from the occlusal to the buccal side, and I can ask this patient to bite all the way down without fear of getting bit. This particular Dexter doesn't want to cooperate. Okay, so we're closing all the, and I'm not taking my finger off until that patient completely bites down. Okay, so your finger is on the inside of that patient's cheek and you're kind of holding that. Okay, we okay so far? Okay, so you've just sort of held that thing down and we're kind of ready to go. So, and then that's when the PID comes into play. But I'm going to take this in chunks, and I'm going to take it very slow because I really want you to get the idea about this. So let me just backtrack on the film. Why do we want to completely cover that canine? This film is wrapped in plastic, and there's a little edge of plastic that is beyond the film. So I'm going to actually take a pen, and I'm going to mark where the film actually stops and where the plastic continues. Okay. So if you were only to get half of the tooth on the canine, if you were only to cover half, knowing where the film begins, you won't get any of that canine. You'll completely miss that canine. Did that make sense? Mm-hmm. Okay. We good, everybody? Okay. So the film is kind of far back at this point. It's not even covering the canine, you know. It looks like it is. Canine's right there, but the film is actually not on this edge. It's a little bit further back. So I take the whole film and completely cover that canine. And then when you actually take the picture, you might be surprised. You're going to look at it and you're like, well, I covered the entire canine. Why don't I see the entire canine? It's because of the film. It's not all the way to the edge. So you'll only wind up with half, which is exactly what we want. We want half of that canine. Okay. I want to start talking about the shape of this patient's mouth generally, okay? So it's sort of like in a horseshoe, right? Sort of like in a horseshoe. When we deal with our patients, we're going to be working with, when we're doing bite wings, horizontal angles. Horizontal is left to right, okay? So it's going to be going left to right, depending on the angle that we're trying to get, okay? So this is what? What angle is this? Vertical. So we will be dealing with vertical angles. I'll get into that a little bit more with bite wings, but for the most part, I just want to try to really focus just on the horizontal aspect of it. So if we look at a patient's mouth, and I use sort of like a stick, and I place it next to the molars, you'll notice that the molars come in horizontally at this angle. You okay? But if I do the premolars and I include the canine, they're kind of like at this angle. Does that make sense? They're not going in straight because this isn't, I'm trying to put this right up against those three teeth. I'm trying to include the canine, the first premolar, the canine, the first premolar, and the second premolar. So that is the horizontal angle of those teeth. We okay so far?
Yes.
Okay. So with that in mind, if I want to use that as a reference for your PID. Now, before I used to just say, just look at this portion of it, you know, as if it was flat. But it just wasn't coming across, I think, a lot of the students when I was doing that, you know. So what I'm going to do is I'm going to go ahead and take this, and I'm actually going to tape it directly to it. So I'm going to take this, and then I'm going to put that stick right on there. So it's completely flat. Not vertical, but horizontal. Okay? And then I'm going to go ahead and take this stick, and I'm going to go ahead and lay it horizontally across those three teeth. So if we are doing the premolar picture, I have to consider the canine, the first premolar, and the second premolar. I have to kind of include this too. I want to sort of split all of those teeth the best I can. So that is the horizontal angle of those teeth for a premolar picture. Do you agree?
Yes.
Okay. So with the PID, I'm going to go ahead and take that horizontal angle, and I'm going to rotate it and rotate it and rotate it until those two are parallel with each other. This is not the parallel technique. This is the bisecting technique, okay? Bisecting pretty much refers to vertical angles. We're dealing with horizontal angles. So those have to be parallel to one another. We okay so far?
I'm sorry, this is not the parallel?
No, so I'm using the term parallel because those two angles have to be parallel to one another. But we are using the bisecting technique. And just so you know, bisecting refers to more so with vertical angles, and I'll explain that a little bit more probably next week. But I want to, it's kind of a bigger concept, so I don't want to overwhelm you guys on that one. So, so horizontal. Are we okay so far?
Yeah.
Okay, so if it was a molar, and that horizontal angle for the molars was going, and so I lean that right up against those molars. It is no longer at this angle. I got to rotate it back to that angle. We okay?
Yes.
Okay. So I'm going to take this off, and I'm going to go over a couple more things. Getting that horizontal is the biggest thing, because if you don't get the horizontal angle, you won't be able to see between the interproximal spaces of the teeth. So I'm going to do this first with the camera, and then I'm going to kind of show you guys individually. So, and some of you might be able to see it right here, but if I'm looking right through there, you can see through the interproximal spaces from where that camera is at, facing this direction. And imagine if I put this right in front of the camera like this, that's the direction that camera is looking, in this direction. So that camera can see right through the interproximal spaces because its face is parallel to these. Its face is parallel to the horizontal angle of these teeth. So it can clearly see through there. But if it was coming at a different angle, like this, there is no way that camera is going to see right through this interproximal space. It is now overlapping. Okay, it is now overlapping. So getting that horizontal angle is really critical to seeing the interproximal spaces. And if we don't get that right, then the doctor can't diagnose if there's decay between the interproximal spaces. So that's kind of your job to go ahead and do on there. Okay, we okay so far on that one? Okay. So let me expand on that a little bit. So if I take this and I go back and I place this standing from the front, I'm really looking at that, you know, and I'm making sure that the edge is going right to the inner, to the very front of that canine. We're in pretty good shape, so I'm going to go ahead and close down all the way. I'm going to rotate my finger to the buckle side, and I'm not going to let go until that patient is completely closed. Now, you can't really see the film at all, okay? But you got to use your anatomy for references. So, so when you have your, what's this called again?
PID.
The PID, yeah. So when you take the PID, and I bring this, I'll do it for the camera first, then for you guys. You know that the front of your film, there's the canine right there. That your film is right to the front of that canine, right to the front of that canine in this picture right here. So when you take your PID and you figure out your horizontal angle based off of the direction of the teeth that you're trying to take, then you want to move the side of this cone over and over and over until it passes one tooth in front of the tooth that you were trying to get. So the tooth that you're trying to get for this premolar picture is what? On the canine, okay? You're trying to get actually all three, but that's where the edge of your film is, right? What's one tooth in front of the canine called? Say it again?
The lateral?
The lateral incisor. It's an incisor, you were right, but more specifically, it's the lateral incisor, not the central incisor, lateral incisor. So I want the edge of this right to the lateral incisor. You don't want to go any further because then you'll miss the back side of this film. You don't want to go on back of it because then you'll get something called a cone cut, and then it'll cut off actually the film. So right to the edge. So I try to break this thing down into three things. And if you do these three things every single time with every film you ever do, you'll generally get a really good picture. So at some point, I'm going to have you guys write this down. You'll see it on the video. Take note, whatever you got to do, make sure you get this thing down. Find your vertical, find your horizontal, cover the film. That's it. For taking x-rays, that's pretty much it. Find your vertical, find your horizontal, cover the film. And if you do those three things, you'll generally take a really good picture every single time, okay? So for the vertical, I'm just gonna have you keep it as 0 degrees. 0 degrees means there's no vertical angle. There's no up, there's no down, it is just completely at 0 degrees. And I mentioned the degrees already because when we go over there to the x-ray room, you'll see that there's a set of degrees on the side of that thing. So not up, not down, but straight. For now, we will change this just a little bit at some point, okay? And this is based off of the patient's palate. It could turn this way, if anything. It could have a little bit of vertical, but for now, 0 degrees. So we found our vertical. How do we find our horizontal? Yeah, we're going to rotate it this way based off of what?
The line, the line of the premolars and the cuspid.
Yeah, if we're taking the premolar, it's the horizontal angle of those teeth. It's the horizontal angle of the teeth you are trying to take. So those are the premolars, that is the horizontal angle. So we found our vertical already. We're finding our horizontal based off of the horizontal angle of the teeth that we're trying to take. And then we have to cover the film. Okay? So questions on the vertical? Questions on the horizontal? Let's find the center of this film. So from left to right, you know where the front of that film is. Where is the front of that film? What's your landmark tooth?
Just lateral.
It's the lateral. So it's the lateral is one tooth in front of the canine. So once you take and you place this on here and you find your horizontal, you're going to move this thing over and over and over until the side of this hits your lateral. Don't go any further, don't go any less. Make sure it goes right to the lateral, okay? But I don't know, so I'm good from the front to the back. But what about the height? Well, the great thing is you have your bitewing tab right there. So see that line going right across? It doesn't always match up in the dental office, but that line should match up to the center of where that bitewing tab is. That way you're not going too high and you're not going too low. That mark will give you a good reference point to line up with that bitewing tab. Does that help? Okay. Questions on that? Okay, so I'm going to go ahead and open this up, and I'm going to pull this canine out, and I'm going to lay it right on that tooth. So that is we're completely covered that, and then here is the lateral, one tooth in front. Okay. And then I could lay all these across and tell you what's going to be in there. I don't know if the camera's going to pick this up, but basically, this is what I was sort of saying, showing you from a top version. I'm going to move this, once you find your vertical, which is completely flat, we're going to move this all the way over and over and over until the side of this cone goes to your lateral. If you don't, and you go too far back, you could cut off the entire canine, and you could see everything that's on the inside of this PID. It will be exposed, and you'll see teeth, and you'll get all these different shades of grays and things like that, but everything on the outside will be completely clear. And it'll actually have the curve of this PID, and we call it a cone cut. So the outside will be completely clear, and the inside will have an image. So you have to cover this whole film, or you won't get a good image, okay? And hopefully that thing is catching it. So, questions on that?
So usually we just have to focus on the line that keeps the cuspid in instead of the back, right? Just because.
Elaborate.
So we usually focus on trying to get the cuspid in the film.
Yes.
Don't really need to focus on the back of the film because.
Oh, gotcha.
It would already be in the.
Yes. Yeah. So you don't need to focus on the back. So so in the premolar picture, this is a great question because it comes up every year. Like, well, what about the backside? Well, as long as if you get the edge of your film by the canine, completely cover the canine, everything else will follow in there. Now I can't put it all in there because this tab is in the way, but we don't so much worry about the backside because it's all going to fall in there. And remember that this is a premolar picture. Now, I do like the idea of sort of considering that molar when you're looking at your horizontal angle, because I want to see the interproximal space here too. It's not crucial because you're going to see it again in the molar picture, and you're going to see that again. But everything will fall into place. So my main teeth, my main focus for these teeth right here are basically these two premolars in that canine, okay? I could care less what's behind there. It's gonna show up anyway, but it won't, but you're gonna get overlapping. I just wanna kind of give you a heads up on that one. Most likely, you're gonna get overlapping on your molars. Whenever you take a premolar picture, your molars will have overlapping. Whenever you take a molar picture, generally your premolars will have overlapping, and it doesn't matter. You want to separate those two. So when you take a premolar picture, your goal is to open up the interproximal spaces for those premolars, and that's it. You're not concerned about molars whatsoever, okay? When you're taking a molar picture, now you have to open up the interproximal spaces of those molars, and you're not concerned about premolars at all. We okay so far? Yes. Okay, so now I want to sort of show you what that looks like. So as far as overlapping, I'll give you another perspective. So I'm going to actually, and then maybe if you want to tap on the screen, and do you feel comfortable holding the camera and sort of holding it up? Yeah, or we can do this. And then I'm actually going to turn these lights off. So I don't know how much it'll get, but I'm going to go ahead and take these teeth right here and sort of show you on the chalkboard. Chalkboard. That was, I just dated myself right there. So this, obviously it's a flashlight, but we're going to sort of show it as like this is your PID. This is your x-ray machine right here, okay? So if you were going to stand anywhere in this room and you were going to look right through those interproximal spaces, and if you want to come a little bit closer, you can all come this way a little bit. So let's do it first. I'm going to stand, yeah, I think that's good. So even if it's the camera, and the camera's kind of getting this, if the camera wanted to see through these interproximal spaces, where would you put the camera at? Would you stand over here? Would you stand over here? Where would you stand? Right here, right in front of it, okay? And it makes sense, and if we think big, but when we get to the mouth, we gotta start thinking in small terms. Right through those interproximal spaces, perfect. Camera is going right through. So I'm gonna take this and I'm gonna push this right up against the whiteboard, and then I'm going to turn this flashlight on, or the PID, and shine it right towards those teeth. Look at the shadow. Okay, so I don't know if the camera could pick up on the shadow. How about like that?
Yeah.
You can see it now? Okay, it is showing through the interproximal spaces, okay? And you can clearly see it on the screen. So that's basically kind of what you're doing, is you're transferring your image to the film using your PID and the radiation and everything like that, and that's kind of the image that you're going to get. But I'm coming in at a pretty good horizontal angle. What if I mess that up? What if I don't see my horizontal angle very well, and I start to turn this way? What happens to the interproximal spaces? It disappears, overlapping. Okay? Does that kind of help you guys out a little bit?
Yeah.
Okay. Okay, so we're going to take sort of what we learned right now, and then we're going to go ahead and go to the X-ray suites, and we're going to build on that. If you were to put your eyes between these interproximal spaces, just your bare eyes, and you're looking at it, you're like, yep, I would stand right here if I was going to look through the interproximal spaces. I wouldn't stand here because I cannot see between the interproximal spaces from here. I just can't do it. So I know that I'm going to look through the interproximal spaces right here. So when I know that this is the exact angle to come in at, I'm going to just take that PID and put it in that same direction. That's it. I'm going to put it in that same direction as the interproximal spaces between the canine, the first premolar, and the second premolar. But you have to look at mini form. So if I'm coming up to this, I'm going to be like, where am I going to stand? Where could I best see through the interproximal spaces? Right here. Then I'm going to go ahead and take this PID and bring it in that direction. And wouldn't you notice that this is parallel with this?
Yeah.
But you have to get up on there, you got to be able to see right through there. Patient smile really big, bigger, and right through there. So that takes care of your horizontal angle without going through all this stuff. I just have to kind of take you through this, rabbit hole kind of, That kind of help?
Yeah.
Okay. So you guys have to decide individually, is it better for you to look through the interproximal spaces, or is it better for you to see the parallel angle of it standing from the front? You have to decide. So some of you are going to be doing this when you're looking at your horizontal angle, and you're going to compare your premolars to your PID, and if you're the one who's going to do that, where you're looking for that horizontal angle, you're going to do this. So I look at the line right there. So I have the patient smile really big. I focus on the teeth that I'm trying to take, and I ask myself, where is the canine? And I don't want an angle like this because it's not, I can't see all of them. I need to see the buccal side of all three of those. And that is the horizontal angle. That is the horizontal angle. Not like this. We can't see all those buccal sides. We have to look at it like this. You good? See the side?
Yeah.
That's the side. That is the angle, the horizontal angle of those three teeth. I'm going to do this one a little bit for the camera first and then for you guys. When you're looking at the horizontal angle of this, if it's turned this way, you're going to notice that this side is more in and this side is more out. I want it to be to where you see sort of an eclipse of here to this side. You're not seeing two different angles. You're seeing it sort of, those two lines eclipse each other. Did that make sense right there when I just said that? Yes. So you're not looking like this, you're looking to where those sides are eclipsing each other. Okay? You good? Okay? You good? You good? Not like this, not like this, eclipsing each other. You okay? And at the same time, you are looking at the line of this. Are they parallel? Are they parallel? Are they parallel? This is without the sticks on a patient, okay? So you're doing this, smile really big, and you're looking at that angle of those teeth and you are comparing the eclipse of this to those teeth. You good?
Yeah.
Okay. I'm gonna stop at this point, okay? That's a lot of information, but I'm trying to kind of break it down for you as much as I can. What I'm gonna have you do is, I'm going to give you two films, and I want you to, I guess I should do this first. Before I have you do that, I lied. I'm gonna come back here again. I'm not even gonna take you through the whole thing. So I'm gonna give this film to you, and then did you do the placement the first time? Mm-mm. Okay, so I'm gonna have you do the placement for the molar on the patient's left side. And I want you to talk us all through it as you sort of do it to the best of your ability.
Just the back one?
Just the molar. So remember, it's the same thing. We're getting the uppers, we're getting the lower molars at the same time. And you have to consider, if we're doing a molar, what other tooth you have to include, and then and take it from there. Okay, so start off with the molars.
Try twisting the knob on the side until you bring it up.
Is your patient fainting on you? Yeah. Okay, hopefully that'll help.
Open wider.
Yeah, for the molars, yeah, your patient's got to open a little bit wider.
Yeah. There you go.
Okay, so this is back here. And then I'm gonna cover up to the canine.
No, that's for premolar.
Oh no, it's for premolar, you're right.
For premolar, we're doing molars, so it would be for the first premolar?
Yeah, the first premolar.
First
So
premolar.
then. Okay, so here.
Three, two, one.
What?
One.
Okay, I'm gonna do it.
Okay.
Okay, I'll verify. I'll take a look. Okay, so if we are getting all the 3 molars, what tooth did you include in this picture?
The premolars,
Which premolar?
the first and second.
So you included both the first and second? Okay.
I think it's only supposed to be the second.
It's only supposed to be the second.
Second.
Okay, because when we did the premolar picture, we only included 1 extra tooth. That was a canine. Why would we include 2 teeth?
Yeah.
You know, for a molar picture. So
I think it's only the second one.
It's too forward.
Yeah, it needs to be.
2 forward. Okay, so somebody fix it, or if you want to go ahead and fix it. So only the second premolar. Only the second premolar. Valerie, did you see it first?
No, I didn't.
Go ahead and head on in, take a look at it. So here's what you're looking for. You're looking for the second premolar on the lower. The second premolar on the lower. And making sure that that's covering. If it's past it, then, you know, we didn't put it. Are we good now?
It's at the first.
It's still at the first premolar?
We're gonna change
Okay.
it.
Okay.
Cause like. Now what happens if a patient has a wisdom teeth already grown in? Do we need to include the wisdom teeth as well?
Or would this like automatically?
Another fantastic question, because some patients' teeth are big, wide,
Yeah.
and when it, this is such a good question, and it's hard for me to answer this one. When it comes to Dexter's, the dental board is looking for something very specific. No matter if their third molar is in, no matter what, your focus is that second premolar and whatever gets in there. Even if that third molar falls off the film and it doesn't cover, and the film does not completely cover it.
So its main focus is the second premolar, the first and second molar.
Yes.
So those are the 3 main things that should be on the film.
With a Dexter x-ray, according to the Dental Board of California.
Okay, but for a normal human, it has to be all 4.
A normal patient, I care more about the molars than I do that second premolar, and I have you push it more towards the back.
Okay.
Okay.
Okay, so it's gonna switch gears, and we are gonna switch gears. When your patients get here, you're gonna switch gears, you're gonna be like, second premolar is not a priority anymore. Most of the time, it's gonna work for you, just so you know.
Yeah.
But sometimes it won't,
So we're fine to move it to like half of the second premolar.
Yes.
Maybe. Okay.
If possible.
Yeah,
for
that's okay.
patients.
Because we don't
Yeah.
want to cut off any of the, like the molars.
I would much rather see that, and the dentist who's going to be looking at your work, I want them to see that you are pushing it that far back. You just have to really work with your patient on that gag reflex,
Yeah.
is all I can say. You know, breathe through your nose, relax your tongue, think about Hawaii, you know, all those things. Okay. Placement's okay?
Oh,
The film placement's now good?
Yeah. It's
Okay, go ahead. Sorry, Valerie, cut you off. Okay, so vertical. Yeah, and you don't even need to place it next to the patient's face. You just finished your vertical. Yep. And that's what I mean by separating, not trying to do all just the vertical. That's it. Okay. Horizontal. Did you do horizontal last time?
I didn't.
You did it?
Yeah.
Okay, horizontal. You can use either method you want. You could either use the parallel thing, Or you could, remember I said, look through the interproximal spaces of the teeth. And this is harder because it's a molar. It's hard to look through the interproximal spaces of the teeth because you got the cheek involved, you know, it's you know.
Yeah, it is hard.
So we can like, if we want to do the parallel, we can stand in front and like look.
Yes.
To see. We're like allowed to.
Yeah.
Okay.
It's not parallel with the molars. It should be straighter because it's angled.
Try standing in front.
And it's okay, just get it the best that you feel like you have it, and okay. And then everybody go take a quick look. You decide individually if you would change it or keep it the same. And all you're looking at is the horizontal angle. You're not looking at is the film covered or anything like that. Just the horizontal angle.
If we wanted to change it, could we, or?
Yeah. As long as everybody else got to see it first.
Did everyone get to see?
No, I didn't.
Okay, go ahead.
See it.
Okay. Everybody else get to see it?
I feel like, oh, I was standing in front, and I feel like if, like this kind of eclipses a little bit, like if I go like this, straight down. I think, no. Yeah, maybe, yeah.
Okay. Just for visual sake, I'm going to break these things out again just so you can see this. Now here's kind of the problem, a little bit. We focused a lot of our attention for the premolar, right? And generally when the patient smiles, it's the premolars that we see more than the molars. So for some reason, we want to keep focusing our attention to the premolars. Well, we got to focus on the molars, okay? So if I'm focusing on the molars, and I have my glasses on, I would be looking at, and it looks like it only has 2 molars. It has the first molar and the second molar, so that's really all I have to go off of. And I have to sort of consider the second premolar, right? Because we're kind of considering all 3 of those teeth. So this is the horizontal angle of those. Are we good?
Yeah.
We are good, yeah. So fantastic job. And that's kind of impressive already, okay? Because that's the heart of the bitewing. Can you open up those interproximal spaces? Okay. I want you guys to finish this up. Cover the film. Valerie, why don't you go and do at least one part of that, covering up the film from front to back, however you feel comfortable, or you can do the whole thing. It's up to you.
I think I can do. I'm sorry.
Okay, go ahead and somebody else verify. And talk us through this. So if we're talking about covering the film, we have to cover from the front to back. So what tooth do we have to consider?
The second premolar.
Right, the second premolar. But the edge of that PID should be where?
At the first?
At the first premolar.
Okay. I think it is at the first.
Okay.
I would say it's at the first.
Valerie, nice job again. Now, when we talked about this, the first premolar, by it being there, we took care of the front of the film and the back of the film. But what about the top and the bottom? How do we reference to make sure we're not too high and we're not too low?
The line should be parallel with the...
Is it there?
It's a little bit higher.
Maybe I'm blind, I don't know. Do this-
You want my glasses?
Closer? Alright.
Okay.
Okay. Yeah.
Okay, what do you all think? Did we do a good job?
Yeah.
Yeah, we did. Okay, let's make this official. I'm going to go ahead and take this, find the button. Okay. For here, we're done. We're going to take this, we're going to place it right over here to the side, and then I'm going to go ahead and take this out with gloves, wet. But because it's so wet, is there something I could do a little bit better than just kind of,
There's lime everywhere.
we don't want to do that, right? So what are we doing?
A towel.
Paper towel. I'm going to wipe this down and then place it in the cup without touching the outsides, and we have that. Okay, so here is what we're going to do now. So here's what you're going to do. I'm going to give you 2 films each, and you are going to do the patient's right side.
So our left.
Yeah.
Always think in terms of the patient, okay? So the patient's right side. Okay, you can think of it in your left, but then if you start to go like, that's my left, you know, then, you know.